Welcome to Using AI to Strengthen, Not Replace Public Health Thinking. Effort is the algorithm. My name is Merlene Tucker, and I'll be running this Dialogue for Health web forum alongside my colleague Jeff Bornstein. Thank you to our partner for today's event, the Public Health Institute. Now it is my pleasure to introduce the moderator of today's event, Dr. Carmen Rita Nevades. Carmen is a senior advisor at PHI Center for Health, Leadership, and Impact, founder of Dialogue for Health, and senior vice president emeritus of external relations and preventive medicine at the Public Health Institute. Welcome, Carmen.
Thank you, Merlene, and thank you to our audience for your continued interest in this webinar series on artificial intelligence and public health. We have actually over 500 people registered for this event. And even though we know that everyone won't show up, we know that this is an indication of how many folks find this to be an interesting and compelling topic, and really welcome your interest. Let me start by introducing Melissa Stafford Jones, the president and CEO of Public Health Institute, to introduce our series and start the introduction of today's presenter. Welcome, Melissa.
Good morning, everyone, and welcome to our third and final webinar in the series on AI and public health, using AI to strengthen, not replace, public health thinking. Effort is the algorithm. I'm Melissa Stafford Jones, President and CEO of the Public Health Institute, and we're so glad you could join us for this final webinar in our three-part series, exploring how artificial intelligence is shaping the future of public health research and practice. Over the course of this series, we've explored both the promise and the practical realities of AI in public health. In our first session, we focused on AI's potential to amplify our ability to meet community needs. In our second session, we explored real-world applications and the challenges of putting AI into practice. Today, we shift from what AI can do to how we should use it in ways that strengthen public health thinking, learning, and decision-making. Today's session is about how to use AI in ways that strengthen, not replace, your own expertise, judgment, and problem-solving in public health practice. We'll explore how public health professionals can use AI tools, not just to support their work, but to become stronger critical thinkers and decision-makers, while avoiding over-reliance on technology. The session will include both practical insights and a hands-on component designed to help participants ask better questions, apply context effectively, and build confidence using AI tools responsibly. We are honored to be joined today by Dr. Tomas Aragon, former state health officer and director of the California Department of Public Health. I am so pleased that Dr. Aragon could join us and be the featured speaker in today's webinar. Dr. Aragon is such an incredible leader and thinker in the practice of public health leadership, in deeply thoughtful decision-making, strategic thinking, engagement of teams, helping organizations to learn and improve together, and how with communities we improve the outcomes and health status of people and communities. So I'm so grateful, Tomas, that you are here with us today. Dr. Aragon brings a unique perspective grounded in decision intelligence and learning science. He will share practical guidance on how to use generative AI to enhance reasoning and public health practice, while avoiding what he calls the agency gap that can occur when we offload too much cognitive effort to technology. As with our previous sessions, I encourage you to engage actively. Submit your questions throughout the webinar, take full advantage of the interactive workshop and the Q&A session at the end. And as we close out this series, we hope you leave not only with a better understanding of AI tools, but with a deeper appreciation for the role of human judgment, curiosity, and learning in public health. This series reflects the Public Health Institute's long-standing commitment to engaging our field on issues that matter most. Over its 60-plus year history, PHI has served both as a trusted fiscal sponsor and a thoughtful partner, helping to seed innovation, elevate creative thinking, and bring forward new ideas and approaches in services of healthier communities. With that, let's begin today's conversation. I'd like to introduce our moderator, Dr. Carmen Navarez. Thank you so much, Carmen, for continuing to facilitate this important webinar series.
That was a really good, really thoughtful way to introduce our speaker. I really want to thank Tomas for joining us today. And just a little bit more on him. He's the founder of Team Public Health at Substack.com and an adjunct faculty at the UC Berkeley School of Public Health. He served in governmental public health for 29 years, both as a state public health officer and director, as Melissa mentioned, but also as the health officer and director of the Population Health Department division at the San Francisco Department of Public Health. So those 29 years have given him some excellent opportunities to view the way organizations work, the way we learn, the way we think, and to really bring some of those learnings back to you. As the CDPH director, he led the nation's largest state health department on its journey to becoming a learning, healing, and impactful organization. He works on promoting decision intelligence for health, which urges ethics, science, technology, and to improve strategic decision-making under uncertainty, trade-offs, and constraints. So welcome, Dr. Aragon.
Thank you, Carmen.
Okay. Well, before we start with your presentation and workshop, I want our audience to know that we really appreciate the questions that they submitted during registration and that we'll be covering many of these issues in the presentation and discussion. And just again, want to direct everybody to the chat where we've posted a document which we think is an excellent companion to today's presentation. So I recommend you download this link. But if you can't do it now, you'll also find it attached to the Dialogue for Health webpage that announced this webinar and in the final posting of the recording. So let me start this off by asking you a few questions which will help to set the table for the discussion to follow. And these questions come from our audience as they registered. First question, many agencies still struggle with data literacy and upskilling all staff on technology. What are your recommendations to support data literacy efforts while implementing AI literacy?
Yeah, so I think it's important to realize that we are swimming in data, and the biggest challenge is not really the data, but it's really our critical thinking and reasoning skills. That we need to improve that so we know how to use the data. And in order for us to do that, we really have to be connected to what are our values and what are our goals. That has to be the North Star, the driver of what we do. And then we look at what data do we need to get us from point A to point B. If we start with data, it'll be like quicksand. You'll be swimming in quicksand and you'll never get out and you won't get to your destination. So it really starts with what do you value, what are your goals, and then what do you need to get there? And oftentimes you need data, and that's where that comes in.
And how can really excellent leadership help to stimulate the incorporation of thinking critically? How do we get our organizations motivated? What motivates them?
Yeah, so what I learned running big organizations is that when you want to introduce a tool, a framework, a way of thinking, you have to be really intentional on what you and how you do it. There's three things that I want you to remember, and that is whatever you're introducing. So for example, if you're promoting quality improvement or AI literacy, it has to address a pain point immediately or add value immediately. So if it doesn't add value and it doesn't address a pain point to the staff person, there's going to be resistance to taking it up. It has to fit into existing workflows. People are really busy. So if you address a pain point in their existing workflow, that's a really good start. And the last one, it has to be something that's universal. And by universal, it means is that it's a concept, it's a way of thinking, it's a way of doing that you can apply at work, at home, and in the community. When people recognize, wow, quality improvement applies at home and to all different aspects of my life, then it becomes internalized And that's how it really spreads. And so you have to be really intentional about those 3 points: addressing a pain point or add value, fit into existing workflows, and be universal, so that it has to be, you want to introduce something that improves work, life, and the community. And that's how you get people. But it doesn't happen by just shoving a new framework down people's throat. It won't work.
That's a good lesson with respect to how to think about what your job is as a leader in getting people to change the way they do things. We need to think about this as not something you just do at work, but really something that you can incorporate into your life and into your daily way of doing things.
Absolutely. Yes, that's the other. Yeah, the work is just part of your life. And so if you can improve people's life, you improve their work.
Simple, but very hard. Okay, so the second question is how might public health organizations address cultural and linguistic gaps in AI training?
Yeah, so a really interesting question. So that question is phrased as a problem. Okay. And so it really comes down to, okay, how do we solve this problem? There is a gap in AI training that has cultural and linguistic gaps. So you have to have an approach to solving that problem, because that problem, the way it plays out, the context of that problem is going to be different in every location. So there isn't a easy answer, but there is a process. There is a process that takes you through solving that problem, because that problem has consequences, that problem has underlying roots, that problem has potential solutions, and that problem has stakeholders and subject matter experts that need to sit at the table. And so I am going to cover that in the talk today, because part of taking advantage of artificial intelligence is to have a process in your mind that you can deploy to solve a problem. And the AI agent is just one element that can help you solve that problem. But you have to have an approach. And I'll cover that. And so it's an approach that people are familiar with, so it should be relatively easy to learn. Oh, you're on mute.
Our mute is taken over today. This is a question that has come up in all of the series, and so I'm going to ask it again because I think it's an important one. How do you reconcile the use of AI with the fact that data centers are being built in lower resourced communities and are resulting in inflated energy costs and the overconsumption of water?
Yeah, that is a great question. And I think the way that I think about it is, in economics, they call this externalities. What are all the negative impacts of something that's being introduced into society? We saw that in industry, that when industries just start operating, they may create a great product, they may make a lot of money, but then they pollute the environment, they pollute the water, they pollute the air. Those are the externalities. And we have to, as a society, get ahead of it, because AI has a lot of externalities. That's just one of them. And so I think it's a great question, because I think public health does have the opportunity to really articulate and connect the dots, and to help and to raise awareness of some of these externalities that are going to impact health, mental health, social health. And so it's like introducing. I was trying to think of a concrete example. The one that sort of came to mind is that when cars became very popular and everybody started driving cars, if you go to LA County, they dismantled their public transportation system and they built all these freeways. And then what happened is that now you have all these freeways and no public transportation system. And so that's an example of where they just went ahead and just implemented something without really thinking ahead of what the long-term consequences are. And it resulted in pollution and traffic jams and stress. And so we have to be, as a society, and public health should contribute to this, be smart on how we implement things, implement it in a way that makes life better, and recognizing that we need to minimize the externalities as much as possible.
That's a great beginning. I know that you have a lot of issues that you want to cover. I just want to remind everybody, please submit your questions via the Q&A. Please give us your comments via the gestures. And absolutely, do let us know if there are technical issues that you're experiencing, because we know these things happen, and we really rely on your participation to let us know if there's a problem. So, Tomas, you have the floor.
Okay, I'm going to put on some slides here. And hopefully you're seeing the slides now. Okay, so you can find some of the things I talk about, you can find on my website, which is teampublichealth.substack.com. The way I run this website is all the content is available for free, 100% of it. So it's for free, and hopefully you enjoy it. Okay, here's the overview. I'm going to give a background introduction. I'm going to talk about effort is the algorithm. I'm going to get into wrangling with LLMs, and then I'm going to have examples and tools. And I have a few quotes here that that actually apply to this talk. Life is the sum of all our choices. So those of you who chose to be on this webinar today, thank you for making this choice. Hopefully you'll get something out of it. Problems are only opportunities in workflows, from Henry Kaiser, and we cannot solve our problems with the same level of thinking that created them. And so that quote really spoke to me, because that's what I think we need to take advantage of AI. Okay, some of the questions that we received ahead of time, what I did was I took those questions and I gave them to Claude, Gemini, and Perplexity, and I said, give me some answers. So when you get it, please read through some of these slides, because there was quite a few questions, and you'll see here the topics. People were asking about project management, strategic thinking, supporting clients, drawing up policies and procedures, addressing workforce. You heard that question. Questions about mental health. So read with these three artificial intelligence, large language models responses, because it's different. Everyone is different, and it gives you an idea of how some things can be more useful than others, and it might appeal differently to different people. Okay, so here are the public health challenges we face include growing socioeconomic inequality and human conflict, climate change and potential for environmental collapse, disruptive in technologies like artificial intelligence. It has a potential to do a lot of good, but also to do a lot of harm. Increasing adversity and threats to mental, emotional, behavioral, and social health. So that is these are the things that we're facing today. So public health must be agile, adaptive, and responsive. And part of it is that we need to become better. We need to become better leaders in helping to solve these problems. And so I have here the things that I think are important is that we need to become a better, decisive leaders that lead with our values. We need to be better at learning and improving. We need to make sure that we promote healing and prevent harm. And we need to be impactful and accountable to the communities that we serve. So how is AI going to help us? So artificial intelligence is a big field. It's been around for quite a few decades. Within the field of artificial intelligence, we know that we can program computers to learn, to get better, to try different things. And so that the ability for a computer to learn is called machine learning. Within machine learning, there are these methods called deep neural networks, and these deep neural networks can take input and then predict output, and they can learn on content data that's coming in, and they can learn to take that data and then produce content. What's different now with large language models is that these large language models not only can predict content, they can create new content that hasn't been created before using all this prediction ability that it has. You see there are multimodal models, and then you see world models. if you follow the field of AI, you'll realize that some people are pointing out that the current models of AI, the current focus and investments are in these large language models, and they say, and this is true, it's it's about language, which is important because language comes from humans, but humans are much more than just the language we speak. It is incredibly important, but there's also just the human experience of walking on the beach, walking through a forest and smelling and looking at the trees, hugging your dog, and there's all these things that we do as the human experience that is not. Large language models can't do that. They can't. They can read about it. They can tell you about it. So there's what are called world models, and so there are people that are moving in that direction and saying that we can do a much better job in really AI helping us understand the world as humans experience it. Okay, so that's a little bit of background on that. Effort is the algorithm. This word, effort is the algorithm, came from a physicist who has this incredible YouTube site that focuses on educating the public about all things technology and science. And they had a session on what is going to be the impact of artificial intelligence on kids learning in school. And one of the things that the experts point out for kids learning in school is the way that you wire kids' brains to learn is through effort. Effort is the algorithm. That's how we rewire our brains to become smarter, is through effort. There is no shortcut. So you have to remember that. And so the reason why this is important, because it's not just about us, but we also worry about the young folks, is that we need to have that, they need to go through that cognitive effort in order to wire their brains to become smarter, to develop social skills, all the things that we need human beings to have. It happens through effort. And artificial intelligence is a threat if you don't use it the right way. And so this is really, really important. Okay, so, and you'll hear the word AI literacy. So how do we begin to talk to people about AI and its impact? So AI literacy, you see here, functional literacy, how AI works. Ethical literacy, how do we navigate the ethical issues of AI? Rhetorical literacy, how do we use natural and AI generated language to achieve our goals? That's great. Okay. And your boss, your organization, your work wants you to be more productive. Then there's pedagogical literacy. How do we use AI to enhance teaching and learning? This is what I'm focusing on because this is so critical in public health. We have to be better at learning because the world is becoming more complicated. The health impacts are more connected than ever. And so we need to up our game so that we can be better at protecting and promoting health. And so we want to make sure that AI serves that need and that it doesn't de-skill us, make us less capable, because I can tell you with 99% certainty that the vast majority of industries that want us to use their product, including AI companies, want to make us dependent on their products because they're competing with other folks. And so we have to just recognize that up front. Okay. Effort is the algorithm. Here is the rule. Improvements in human cognitive, emotional, behavioral, and social capabilities must go through expenditures in human effort. This is called productive struggle. Changes in SEB's capabilities are mediated by the effort-activated rewiring of our brains. Unfortunately, through cognitive offloading, generative artificial intelligence can lead to decreases in cognitive capabilities, including reasoning, critical thinking, and problem solving. You can add writing here as well. Naturally, we should be very concerned about the adoption of generative AI tools and their potential negative impacts on our human capabilities, especially for our youth. So this is the most important thing that you can take away from today's talk. is this rule, because then you design the use of AI to make you better. Remember, your boss only cares about your productivity. We care about becoming better people, not just being more productive. And so you want to make sure that you do that. So generative AI impacts humans along three key dimensions. One is value. We want to add value to ourselves, our client, our patients, our community. Cognitive effort, which that's required for learning, improving, and brain rewiring, which is also called neuroplasticity, and human capability without JI assistance. In other words, we want to become more capable even when our AI agent is not next to us helping us out. We want to develop our human capabilities. So combined capability, human and Gen AI can lead to increases in productivity, but not necessarily increases in human capabilities when Gen AI is removed. Agency gap is a decrement in human capability when Gen AI is removed. This can be avoided if we use Gen AI wisely. We do not want agency gap. So here is a three-dimensional X, Y, and Z axes. So there are eight quadrants here. There is the four quadrants above and the four quadrants below. On the y-axis, you'll see positive value and negative value. When we use Gen AI, we always want to be adding value. So we want to be in the top four quadrants. We don't want to be in the bottom four quadrants. You'll see there, AI has the potential to increase cognitive load by testing you, by challenging you, by using the science, learning science to actually improve your learning, or it can decrease your cognitive effort through cognitive offloading. Okay, and then it can increase your capability. This is now the z-axis going z-axis. Increase your capability or decrease your capability. So we're going to start off with, I think we're going to start off with the top four quadrants. If you look at the top four quadrants, we definitely want to be the top four quadrants. Even better, we want to be in the top two of the top four quadrants. So we want to use AI in a way that increases our capability. So for example, studying a language, there are apps out there that take advantage of learning science to accelerate your learning a language. So the good apps take that into account. So you still have to do effort, but for the amount of effort you put in, your language capability improves more fast. You look there on the bottom left quadrant, you see AI writing a work report. Okay, your boss may not care that it was written by AI. They only care, is it accurate, and is it going to meet the needs of the people above me who are breathing down my neck to get this report out. So that's all they're going to care about. And as long as it's accurate and it achieves an organizational goal, they're going to check that box off. Great work. But the downside is that it actually might be decreasing your capability to be a good writer, to be a good analyst, to be good in reasoning. A really great example of this is Google Maps. So I use Google Maps all the time. But guess what? I have my kids are in their 20s. I don't think they've ever used a paper map. And so think all of us can relate to this. We become so dependent on Google Maps that many of us don't even carry paper maps in our cars anymore. So we have a decreased capability. It is a decrease in effort and friction, but it adds value because it gets you to a place. It gets you to a place most of the time. Okay, so you'll see coding assistant. I'm going to come back to coding assistant because it depends on how you use coding assistant. This is really important. So negative value, you never want to be down here in these quadrants. You never want to be using AI in a way that adds negative value. The obvious one is AI writing your school paper, okay? It's negative in many ways. It's the wrong thing to do, and it's decreasing your capabilities to write papers. This has been well documented scientifically. So here you see here, I call this a human cognitive effort capability curve. On the bottom, you see increases in human cognitive effort, and on the y-axis, you see human capability. So healthy increases in human cognitive effort increases human capabilities. So when I go from A to B and I'm increasing cognitive effort in general with the right task, I become better at doing something. So the more I write, the better I get at writing. Even if it's a pain in the butt, the more it's just that's just we know that we all are familiar with this experience. So what do we want AI to do? This is what we want AI to do. The bottom line is the same line I showed you before. We want AI to create the red line. So for every input in human effort, it gives an output that's even more better for human capability than if we had not used AI. That is our goal. This is the type of relationship that we want. So appropriate AI systems can increase the rate of output of human cognitive capabilities per input of human cognitive effort. So for example, in language learning, there's things that's called spaced repetition. There's a science of how quickly we forget things, but if you get tested at the right interval, your ability to recall things goes up dramatically. So spaced repetition is fantastic. AI can help you do spaced repetition and keep track of what works for your brain and can help accelerate your learning and recall. So this is what we want. So this is an example. I'm using here. This is an app called VS Code. It's just an app for editing programs, programming and coding. So you'll see there in the middle, you'll see there's a bunch of code there. Don't worry about what language it is. And you'll see, so in VS Code, I actually have Gemini, I have Claude, and I have Chat. So I have the three agents all open at the same time. Okay, so when you're working with these agents and you're writing code, and it's not necessarily code, it could be just writing a paragraph. In this example, it's code. It's code, but sometimes the agent will just give you suggestions. It will give you a lot of suggestions, and it drives me nuts because I'm trying to focus. I'm trying to write, and he keeps giving me all these suggestions, and I'm thinking, oh God, should I be taking that suggestion or not? So that is intrusive. That's intrusive. So that's one way that AI can work. That's called, from the AI's perspective, the AI is being proactive. It's trying to help you by overwhelming you with suggestions. So we need to realize that these coding agents, but this is a general principle that applies. I'm using coding as the example because it's very concrete and I've experienced it. Is that we want to recognize that it's operating on a certain type of approach. So what I described there was Gen AI being proactive. It's just flooding you with suggestions, and it might be Microsoft Word and whatever it is, versus human reactive. The better way to use it is that we turn off the suggestion thing and we only use it when we have a need. Okay, so there's three different types of needs. One is you're just asking a question. That's answer seeking. That's okay. It's not, sometimes it's better to look things up yourself. Scaffolding is when you're asking it to teach you. So as you're going through code, you see something you don't understand. You can go to a manual, but that takes time. It's much more efficient to say, can you explain to me about this function? How does it work? Why is it important? Is there a better way? So it can become a tutor to you, but you ask it. It doesn't offer it until you need it. So this is called needs-based. And the last one is evaluative seeking. This is really the best practice. This is where you want to live. If you live over on that side, evaluative seeking, that's going to supercharge your learning because you always try things on your own first. Go through the productive struggle of trying to figure stuff out and then ask, okay, give me feedback. What did I get this? What did I get wrong? And then you have to go and you have to fix it yourself. So this requires more work on your part, but you're getting an assistant that's giving you critical feedback. The other thing I want to point out is that this is what we should be doing with humans too. We should be seeking feedback from humans. And oftentimes what prevents us from getting feedback from humans is the psychology of interacting with other humans. We become sensitive, we become defensive when people give us feedback. So we have to realize is that this is also a trap. You have to be careful because you do not want to become the person that only gets feedback from AI agents. You also want to get feedback from human agents and learn how to develop the social skills to get feedback, feel a little embarrassed because feedback stings, learn how to give feedback. So we have to recognize that even what I'm telling you can improve you in your coding skills. It actually may make it worse for your social skills. So I'm calling that out because I want you to recognize is that the AI agents are easier to interact with because they're not going to judge you. And sometimes we don't want to interact with humans because they're going to judge us, but we have to recognize, I do need to interact with humans. So we want to balance this. Okay, wrangling with LLMs. Okay, so when I think of AI, I'm thinking of really four words: research, reasoning, creating, and coding. Okay, so under research and reasoning, we have these large language models, and they work in four general ways. One is a large language model has been pre-trained on a bunch of data. Okay, but the training ends at a point in time, and so that's all it has is that pre-trained knowledge. So what do they do in order to make it more relevant to you in today's world? These generative AI models, these I'm going to call them agents because that's basically how these things actually work, is that they not only leverage the pre-trained knowledge, they also will do a web search. And then deep research is when they go through and use much more deep research, but they do a lot more reasoning. They plan out and they try something, they learn from it, and then they keep going and they're making decisions about what direction they're going to take. And so this uses a lot more reasoning. This reasoning word is really important because guess what? The same things that make large language models and generative AI better, which is better reasoning, is the same thing with humans. Us humans have to become better at reasoning. The better we become at reasoning, the better we are to be able to take advantage of large language models. So there's a parallel here. The very thing that makes artificial intelligence better, which is better reasoning, is the same thing that makes human intelligence better, which is better reasoning. But that requires cognitive effort, and that requires intention on your end to be committed to putting in that cognitive effort. Because if you just give it away to AI and we dumb ourselves down, it's not good for us as just human beings, but we're going to be less effective as public health professionals. Okay, deep research, retrieval augmented generation is when it goes beyond. It's able to take current documents. When you give it data, better sources, it can incorporate the better sources with the first three bullets there and actually produce more accurate results that have less hallucinations. So that's what RAG is. You don't really have to think about it other than to know it's happening on the back end, but you can provide a context. You can provide it documents. So the more context you provide through documentation, examples, it's going to use RAG to incorporate it with the first three bullets, and you're going to get better results. So it's really up to us to really do that. Creating and coding, you have artifacts. Artifacts is just the creation of local files on your computer. Okay, it might be images, might be Microsoft documents, whatever it is. Connectors are this ability to connect to other apps on your computer and also to connect to apps in the cloud. So it enables things. It enables these AI agents to actually do work for you, but work with your other apps. So they can be doing work. They can be answering your email, for example. Then we have agents. So agents are things that are they can be autonomous. They actually plan. They study what they do, and then they adjust. So it turns out agents do PDSA. So quality improvements, we have PDSA, and that's exactly what agents do. And we should recognize that when people think, oh, they're using, we hear that it's using reasoning. Well, what do they mean by reasoning? Well, the simplest one is just PDSA. Agents can code and build applications. I'm going to show you really quickly that you can do this actually. It's called vibe coding. It's almost too easy. Work can be scheduled and be autonomous. Okay, so here's the agent loop. And the agent loop, agentic loop. This is what they call it. Guess what? It's just PDSA. So you give it a prompt, it gathers context, that's a planning. It takes action, that's the do. It verifies results, that's the study. And then that blue arrow going back, it acts on what it learns, which is just adjust, okay? The agentic loop is just PDSA. And all you're doing is you're guiding its PDSA loop. And so PDSA is a really, really powerful framework. It is scientific thinking. And we want to become better at scientific thinking, because the better we are at it, the more we can guide AI. Okay, so that's pretty simple. So now when it comes to getting prompts, so here's what Claude told me about giving prompts. Set the stage, give it some context, give it a task, and specify the rules. Pretty easy to remember, okay? So you don't need to spend a lot of time trying to study prompts, because you can just ask the AI agent describe what you're working on and say, can you tell me what kind of prompt is going to be better? Or you can ask it to interview you. So it's much more flexible. It's not as if you'll see a lot of things out there. People are memorizing all these acronyms for what is a good prompt. The prompt is basically common sense. I'm going to show you public health thinking. If you use just your public health thinking, you'll be totally fine, and then you interact with it, and it'll help you. Here's one that came from Andrew Ng, and I gave the YouTube link there. This one's kind of fun because he shows you how to build an app. And I'll show you a little later about how to sort of where you would do that in an AI agent. But he says you just have to give it a goal. You have to tell it what input you're going to give it. You're going to tell it what layout you want on the screen, what features you want, and what the output is. And it's amazing. It's really cool. So here is an example. He gave 4 prompts, and those 4 prompts gave these different 4 outputs. This was creating a birthday card. And all those 4 prompts could have been given at one time. He broke it up so you can see how the app that was created, in this case, a birthday card app as a web page, was created just using how it evolves using just prompts, sequential prompts, but it could be one big prompt, and you would get the last one. I'm showing you this because it's relatively easy. It's relatively easy to do, and it is kind of fun. And then he shows you another one here to build a simple game. And so I tested this last night, and I don't spend time doing this because I'm too busy with other stuff, but I tested this last night and it worked. It's fantastic. Okay, so what do we need to, so that's easy to do. So vibe coding is relatively easy to do, but we need to solve bigger problems than just creating birthday cards, okay? So what I've been promoting on my website is value-focused, decisive leadership. And it's really pretty straightforward. Leading with values. We always want to know what we're trying to accomplish. Ensuring good decision quality. I'm going to define it. and then getting results in a way that inspires trust. Okay, so values include core values, context values, professional values, and organizational values. So imagine, why am I telling you this? Because this is all part of context, okay? If you want an AI agent to do something for you, you have to say, we're going to do this in an ethical way. You have to know what you value, what's important to you, so you can communicate it to the AI agent so that it incorporates it. Decision making is an irrevocable allocation of resources. The resources we expend every single day include time, energy, money, people, physical assets, and opportunity costs. So decision making is a good framework for organizing your thinking. So here's what I recommend that you work on, which is really learn how to apply PDSA problem solving. And we know that we know AI is already using Plan, Do, Study, Act. Okay, it may not know it's using PDSA, but it is. We apply PDSA to problem solving. So when you have to say to yourself, what is the problem? So one of the questions I got had to do with cultural and linguistic gaps in AI literacy. That's the problem. What are the consequences of that? You can probably make up some consequences, but you could also ask the AI agent, can you please, has there been any research on the consequences of this problem that I'm thinking about? And there may be a literature out there on this very problem. Those are the consequences. You can say, oh, okay, can you also look into, is there any science on what are the underlying causes of this? Why is this happening? Somebody may have done research. So use PDSA problem solving, how to organize your thinking and how you work with AI. And then you have to develop potential solutions, which are called countermeasures. So this framework right here is the framework that I carried with me throughout the whole COVID pandemic. Everything I dealt with, it was just using this lens in terms of problem solving. Okay. And then as you're problem solving, you're making decisions. What problem do we prioritize? Do we work on today? Okay, that's a decision. What causes are we going to choose to address? That's a decision. What countermeasures are we going to select? That's a decision. So problem solving, embedded in problem solving, is decision making. So what goes into good decision making? You'll see that there on the DQ checklist. So when you're thinking, are we making a good decision? You can use this checklist here. You'll see there under what am I really deciding? Helpful frame, that is context. Clear values and objectives. Do we know what we care about? Do we know what we want to achieve? That's going to help you develop good alternatives. And prospects are just, what future states do we care about? So future states, when we teach people decision making, we tell them, think about the best that can happen and what are we going to do to get there? Think about the worst that can happen and what are we going to do to avoid it? So there's a way of thinking. So everything I'm telling you right now is exactly what I would do with an AI, with artificial intelligence. I'm going to say, we're thinking of doing this. What are all the ways that it can go wrong based on other people's experience? There might even be a literature out there on this, because you want that information because it's going to help you in your public health planning. You want to learn from what's out there. Okay, useful information. You'll see down there sound reasoning. So when you're checking decision quality, you're asking, am I using sound reasoning? Your default should just be PDSA problem solving. Just make that your default. Start there. And you can adapt other frameworks down the line if you want, but you have to have at least one. I find that this one is the easiest one to deploy, and it's incredibly powerful. And you'll see things on my website. I show you examples how powerful PDSA is. So here's PDSA again. PDSA, when you have a problem and you're thinking about the consequences, that's prognostic thinking. Prognostic thinking, that's a type of reasoning that has to do with risk and looking forward. When you're asking what's the root cause, that's diagnostic thinking. So in the clinical space and in public health, we are doing prognostic thinking and diagnostic thinking all the time, but we don't usually think of them as ways of reasoning. The reason why I'm spending so much time on doing this is that AI can really supercharge your diagnostic thinking and can really supercharge your prognostic thinking, because it can review, it can sample information and knowledge spaces that you just don't have access to and summarize that so that you can bring it into and help you solve your problem. And then countermeasures are just interventions, and think of them as treatments. Treatments can be effective or not. And so you apply the same kind of thinking there. So effectiveness thinking is a way with countermeasures. So you'll see when you get, so this is just, oh, yeah, this is just that the decision circle with the questions there. So that's your checklist. Scientists spend over 15 years coming up with this. So what I'm showing you here is based on science, and it's really important, and it's going to help you use AI better. And AI is discovering some of these things that I'm telling you right now. So this is just the table version of PDSA, and you'll see there bolded problem, consequence, root cause, and countermeasures. You'll see on the left first column, plan, do, study, act. And you'll see a few other things, a few other questions. When you take all those questions together, we call it A3 thinking. So we're talking about background. Okay, well, what is background? Background is context. And that the AI needs context in order to give you good answers. And then you use these different reasoning approaches to ask very specific questions. So when you're thinking about the consequences, you're doing prognostic thinking. And if you don't know anything, then you're sort of, I call it discovery. When there is no answer, you're in the discovery phase. We don't, and this is where research comes in. Research helps answer those questions where there's those questions where we don't have answers yet. Okay, let's see here. So take a look at, so this is it. You can see here the link to this Google Doc. So when I tweak this table, you can get the latest version there. I also link to some articles that you can read from a website that talks about how to use this. But this is how to use AI. This should become your prompting framework for how I work with artificial intelligence. And you don't have to use all of it. You can be just working on a component of it. I'm just interested, for example, just in effective treatments for this type of mental health issue, okay? Effective prevention strategies around this type of outcome. So you can be working on components of this, but this gives you that whole framework. And this is what makes public health different than other fields, is our ability to have this problem-solving framework that's based on scientific thinking, and it is the foundation of investigation. Public health does investigations, and that's one of the reasons why I love public health. Okay, so that's probably the most important thing that I covered. Okay, I'm gonna speed up because I know we have to 12:30. Yeah, we have till 12:30, so I better speed up. Okay, issue raising. It can help you brainstorm. You can take a look at this. It could help, here's an example of a SWOT: strengths, opportunities, weaknesses, and threats. It can sample information and knowledge bases out there to help you see what other people have already experienced and bring that knowledge base into the problem that you're working on. And so that's valuable. You still have to do the thinking. You still have to solve the problem locally. You still have to engage local stakeholders, decision makers, SMEs. But it could help you come more prepared by learning what other people have learned. And you could ask it very specifically to go to authoritative sites, to use peer-reviewed literature. That's what I do. We as humans have knowledge and information blind spots. This matrix here is called the known unknowns matrix. Use AI to sample those information spaces that you either don't have time for, you don't have time to seek out, you don't have time to summarize, or you don't even know they're out there, but they're out there. Use it as a way to sample these spaces with some guardrails, like please use authoritative websites, universities, for example. And this is what's really powerful in that information stage of making good decisions. You want to be able to take advantage of information that's out there. So it's going to accelerate your learning, and it's going to accelerate your ability to actually deploy decisions. Okay, I'm going to quickly go through examples and tools. So the other thing we have as public health people is that we have productivity challenges and opportunities. My biggest thing for years and years and years is just managing all the information and knowledge management, okay? There's product and task management, and then there's calendar-based event management. So when I spend a fraction of every day and every week thinking about how do I organize things so I can be personally productive and deliver on the things I have to deliver. So here's how I organize it in my mind, and you can here it is visually. Okay, so you see there the dotted line is your computer. The cloud is above in red. You'll see there in your computer, you see three different things. You have local applications. You see your local folders that have a bunch of files. Those files are called artifacts. And then I'm sharing with you how I do it. I have a special folder where I have markdown files. Markdown files are just basically text files with a .md extension. Why am I telling you this? Well, because it's a way of just managing your notes in a way that are future proof, because they're just text files. They can be read into the future. It doesn't depend on an app. But it also turns out that markdown files is how AI manages a lot of information. A lot of these AI agents, they manage a lot of this information sharing with each other through these markdown files. And markdown files are readable. Anybody can read a markdown file. And so this is what I carry in my brain. And so think of AI can help you in the cloud, but it could also help you on your computer. And when it does it within folders. And doing this, having AI work on your computer is something you have to proceed with caution, because it's on your computer. You're going to have it working on your computer, and it's gotten to the point where you can actually download specific AI apps, specific large language models that sit on your computer and are completely autonomous and disconnected, and can do really powerful, useful stuff for you. So this is how I think about this. Okay, so let me just show you. So the foundational models, large language models that are foundational, is Claude from Anthropic, Gemini from Google, GPT-4 might be up to 5 now from OpenAI. I primarily use Anthropic and Google products. You can experiment with them. For my Markdown editor, you can use anything that edits text, but I like Obsidian. That's my preference. It is available for free. I'm showing you what's called for those who are more techie, Jupyter notebooks. And the two that I really like are VS Code that I showed you earlier, and Positron. And then you have the terminal. I'm going to show you this in a second, that you can use for coding assistance. So I'm going to show you Claude as the example. The concepts that I'm showing you with Claude, everybody's doing them. They call them slightly different names, but everybody's doing them. Anthropic seems to be really leading the way on how to do this. So Claude, I can just download the app, and you might be asking, Tomas, how do I download and install it? You just go online, go to claude.ai, you open up the chat, and you say, can you tell me how to install something? And it will walk you through, and it's just amazing. Nobody has to teach you that anymore. If you're on a Windows machine, you just go in there and say, I'm on a Windows machine. Please just walk me through installing this app. And it'll tell you. So this is a Claude app. You'll see on the top right-hand side, you'll see chat. So that's a chat bot that communicates with the cloud. Co-work is working on things in your computer. It's working on your computer in your folders. You give it permission to work on a specific folder. So you may be having a project and you say, and you're going to be producing a product and you have a lot of background documentation. You say, let's go to this folder. We're going to get some work done. And it's going to produce files for you. Those files are called artifacts. And then you see there, the next one, you see their code. Code, again, works in a folder, but now you're being intentional with either it's going to be using code to change things in a more technical way, including building applications. You can specify what model. You'll see down there, you see the thinking button. That's when you turn on the thinking button, that means it uses more reasoning. What does that mean? It uses more PDSA thinking is what it does, more PDSA problem solving. On the right-hand side, you'll see there, I went ahead and did a different thing. I called up a different menu there. You'll see there called skills. So what are skills? Skills are just markdown files that just tell the AI agent what to do. It's just a markdown file. Let's say you have a certain preference for how you work on something. You say every time you come here, you're going to read this skill file. It's going to read. This is just written in human language, and it understands. Oh, Tomas always wants me to do things this way. And so it wants me to think like a public health professional. It wants me to only use authoritative websites. It wants me to use peer-reviewed literature when it's available. I just write that stuff out, and that becomes a skill, and it's then available to the AI agents. And so you don't have to type it in over and over and over again every single time. It just loads it up and says, "Oh, this is how things get done." So that's skills. Here is co-work. Co-work is now, you'll see at the top there, it says project management and knowledge. So you're in a folder, you're putting all your source documents. It might be these really big reports. And so it allows you to work on a specific project with a lot of your source documents. This is when it becomes really powerful for you because it can read all these documents and incorporate it and give you really accurate, authoritative answers and help you solve problems and create files for you, et cetera, et cetera. So remember, everybody's doing this, but I'm giving you just a general overview here. So that's working co-work. Coding, I'm showing this to you. This is not my emphasis. I showed you earlier that you can do this. You can access, again, you can access folders and you can start doing some coding stuff. I'm not, this would take more time to do this. So here, so you see here on the right-hand side, here's a markdown file. A markdown file is just text. It's just a text document and it's human readable. That's how, on the right-hand side is how it looks like in a text editor. On the left-hand side is the exact same document, how it looks like in Obsidian. So Obsidian is a markdown editor that gives you a preview that is easier and much more easy to consume. So both of them are basically, they're both working on markdown files. Markdown files are important to be aware of because that's how these agents share information, and you can make up your own. You can make up your own and give it instructions so you don't have to be typing it over and over and over again. Google Notebook LM is another thing that this is an example where you can go into the cloud and give it a bunch of authoritative documents, and it will study those documents and then use them to solve some of your very specific problems just based on the documents that you've given it. The example that I use it for all, I use it all the time for all kinds of things. I'm going to mention really quickly. So when I was retiring, I went through and I downloaded all the documents from the retirement, from the state retirement, San Francisco retirement, all the health documents. I put it all there, and then all of a sudden I have an expert. I can ask it all kinds of questions about my retirement and rules. It is more helpful than a person because it becomes an expert in all those documents. And so this really helped me. On the right hand side, you can see you can ask it to create audio overviews, videos, reports, flashcards, quizzes. It's amazing. So it's really one time I was going to be interviewed by CNN on the wildfires, and I wanted to get up to date on what's the research on the health impacts of wildfire smoke. So I downloaded the most recent scientific review articles. I uploaded it to Notebook LM, and then I basically worked. I had to create an audio overview, and so I worked with it in several ways to interact with the material so I'd be really comfortable on the CNN interview because I needed to get up to speed really fast and have that and be prepared for that interview. And that's how I did it. I just used Notebook LM and it was amazing. And so it's so powerful. Okay, this is it. So I covered background and introduction. I covered effort as the algorithm as the most important thing. We did some wrangling with LLMs. If this is the first time you're seeing this, I know it's a lot. And what you want to do is go through the slides again. Anthropic has really good basic tutorials. Deeplearning.ai has basic tutorials. I have links in the slides. And if you remember to start with your reasoning capabilities as the North Star, your values, what you're trying to achieve, and your way of thinking, which should start with PDSA, you can guide AI in a way that increases your cognitive load in a way that makes you smarter and a better thinker. There's no shortcuts. There's going to be increase in cognitive load, just like watching this webinar. If you're gonna commit to learning, you have to invest some cognitive energy. There's no shortcut. It's just like I told Carmen, it's just like going out to exercise. You're not going to get stronger if you don't go out and move those muscles and go out there and exercise. It's the same thing with your brain. We want to exercise our brain, but we want to exercise it in a strategic way. And these tools allow us to use scientific thinking and our public health investigative approach to leverage these information sources and tools out there to make what we do better, but in a way that makes us smarter, not dumber. I hope that made sense.
Well, Tomas, I don't think I'm the only person on air right now who feels like their brain is about to explode. But I do appreciate you're going through all of that information. I know still that it only scratched the surface. And let me just sort of reflect a couple of things that I'm hearing from the audience, and just we'll get into some of the questions. I want to encourage everybody to post the questions that you have, but first, most important, exactly where can people go to find your slides, and how can they use your website to find the information that they want to go back to and really get into?
So these slides you're going to post on Dialogue for Health. And
Yes.
then I will be posting them on my slides. Let's see, where am I going to post them? I'm going to I'll do a blog entry on this. I'll do a blog entry on this and I'll post the slides. But you'll make the slides available, and I'll make them available really soon on my website. Yeah.
Excellent, because there's so many links there that are just that really deserve some study. And
I'll post something today as an announcement. So yeah, I'll do that later. Yeah.
Oh, excellent. Okay. So one of the questions that comes up over and over again in this series, and of course comes up here today, is the issue of ethics. And I want you to talk for a moment on a couple of things. One, how should we make sure that our reading audience, or the audience that we're trying to serve, understands how and in what ways we've used AI to come up with the materials we're reflecting back at them, or the papers that we're submitting. So how should we credit our thinking against the thinking again that we're using from AI? So start with that, and then I'll come up with the next question.
Yeah, well, so ethical, ethics is basically how we reason about the trade-offs around moral values. That's what ethics is how do we reason around the trade-offs with moral values. And so the moral value here is honesty, transparency, right? And so in order for us to build trust and have credibility, we have to be honest and transparent with our stakeholders, our communities that we care about. So we want to let people know when we're using tools, because that's how you're going to build trust. It's just it is, we have that core value of being trustworthy, being transparent, being honest, and that's why you want to do that. So that's how I would answer that. Ethical decision making is a whole category in and of itself, because you may have the perfect 100% effective intervention, but for a community, but if it clashes with their moral values, that effective treatment you have may actually not people may not uptake it at all. So the clash of values, the trade-off of values is really important and ethical in decision making. That's why I call it value focused decisive leadership, because we always should be leading with values, including thinking about the trade-offs and the clashes with values. And that's where ethical reasoning comes in, when people have different values where there's trade-offs or disagreements. And so from right off the bat, we want to recognize that it is part of good decision making. That's why we want to lead with values. We're always conscious and aware of that.
So this, of course, leads into a little bit of the question about regulation. And I just want to take a moment to say that we're in that time where our own federal government is trying to decide in what ways it wants to propose regulations around AI. And I want to let the audience know that a document's been released recently that was summarized today by Carnegie, looking at how the Chinese are looking at AI and AI regulation, and that there are really very different ways of thinking about how to control the industry. I wonder if you have any thoughts on that.
Yeah, so it's an important question. It's like many of these big things that are out there that have all these uses, these potential benefits, potential harms, these externalities, and that the technology is outpacing our ability to develop policy around it. And this is one of the problems. This is one of the challenges with AI, is that it is improving, it is learning at a super exponential rate. Things are moving so fast. And so I think in public health, one of the things that we can do is to really think ahead about the potential health impacts of this technology. And part of the thing that I'm focusing on personally is how do we develop our human capabilities independent of AI, so that, because you have to be able, we want our capabilities to be really strong, so we know how to use AI and not become dependent on it. And so I think there's going to have to be some ways that we regulate how it's used in schools, for example, because you don't want kids to be using AI and then they can't, let's say they use it to write their papers and they're unable to think and write their own papers. So we have to when I think of regulations, I think of more of it as policy development, because there's organizational policies, there's legislative policies, which oftentimes are regulations. But so I think of it in the policy space. So in education, it's going to be really, really big. It's going to be really big. In organizations, it's going to be important. That's what I'm trying to get you to recognize, is that you can use it in a way that makes you smarter, not dumber, and to recognize that the companies and your supervisors don't care if you become dumber. They only care if you become more productive. And so we have to be cautious that sometimes you may not have leadership that cares about your development, right? Because every organization is different. You're lucky if you have a leader that cares about your development. But if your leader may not care about it, so it's your responsibility to take care of yourself and your family and make sure that we don't use AI in a way that harms us in the short and long term.
On to another question. How big of a problem is the AI hallucination with the newest generative AI? And so how confident should we be when we're using AI to ask questions?
So hallucination is always going to be a problem. So we always have to think about how do we verify things. And one of the easiest ways to really minimize hallucination is to use authoritative source documents. And so I try to use authoritative source documents as much as possible. Even when I'm having it do research on the web, I give it a few background documents so that it's grounded on science and literature. And then I give it guardrails. I say, please only go through specific sites, specific authoritative sites and peer review literature, and give me the citations. And then I look at the citations, and oftentimes what I find is its synthesis is, in general, its synthesis is less useful to me. Sometimes I read a synthesis and I say, oh, that's a great synthesis. I really like the way it did it. More often, it identified resources, websites, published papers that I was not aware of. And then I look through those and I go, oh, that's, to me, those are the gold nuggets, is identifying those sources that I can really then dig into and understand. And sometimes I'll pull a source, and I'll use Notebook LM depending on, one time I had to read a paper on the molecular biology, the genomic evolution of SARS-CoV-2 around COVID-19 pandemic, all technical stuff. And I didn't understand all this genomic evolutionary things. So I gave it to Notebook LM and I read the paper myself. I had Notebook LM create a podcast. I listened to the podcast, and then I realized I missed some major themes. I circled back and read the paper again. So this iterative process of me struggling with the material, having Notebook LM review it, and I got some amazing insights about the genomic evolution of SARS-CoV-2 that really help explain the pandemic as we experienced it. And it was just fascinating. It's like incredible. It's a web talk all its own, but it's really interesting how the organism, from an evolutionary perspective, how we evolved and how it impacted how we experienced the pandemic. But I would not have been able to appreciate that paper if I had not had Notebook LM give me a different a way of looking at that paper, because it picked up themes that I did not pick up as important because I'm not a molecular biologist. Right? If I had been a molecular biologist, I probably would have picked up those big themes immediately. I had it. My brain is wired by public health and epidemiology, so I missed some of those nuances. But together, we uncovered it, and I learned so much. It was a transformative experience. That one paper is one of the reasons that got me really excited about using AI and recognizing that I still had to read the paper. I still had to struggle with the concepts.
No question, effort is the algorithm there. So I want to ask you a really important question. I'm sure a lot of people are asking who are working in the healthcare field, but how would we use AI for data analysis while still complying with HIPAA and protected health information requirements?
So AI in the healthcare space is going to play a big role because they sit on tons of data. Think of all the biological data, the imagery data, the laboratory data, the longitudinal data they have on patients. So it is a complete mind. It is just, you're going to be, an AI is going to be helping in all different, not just in the examining, not just in the interview, in the clinical exam room where people are asking questions, accessing electronic medical records. But then you have on the back end, on the administrative side, helping. So AI is going to have a big. I don't have a short answer to that, other than yes, people recognize that the ethical issues are really huge. So one thing I do say is that because healthcare systems have so much data and information, you're going to see a lot of use of AI there. The way I think about it is that in public health, we're above the healthcare systems, and we're dealing with environmental health issues, community issues, different agencies. In public health, we deal with more than what healthcare deals with. So we actually deal with more uncertainty. And so in some ways, learning how to use AI as a public health professional is going to make you more well-rounded, because you have to deal with a multitude of things. You have to deal with communities, elected officials, all the things that public health people have to deal with, and we don't have access to a lot of this data, right? We don't have access to a lot of this. A lot of the data is sitting in communities, in the minds of community members, right? And so we have to figure out other ways of accessing all that information. So in public health, I think a public health person is going to be more well-rounded on how to leverage AI for a multitude of uses, compared to a person who in a clinical setting where it's just going to be driven by all the data that they're sitting on. They're so focused on the data that they kind of miss the point. They don't see the big picture because they're sitting on tons and tons of data. There's so many uses that's going to keep them busy for many years. But in public health, we struggle with a lot of uncertainty, trade-offs, conflict, misinformation. We struggle with so many other different things that we will become better and well-rounded compared to people who just focus on healthcare.
Well, with that being the last question that we had time for, there are a couple of other questions that are really important that I'm going to ask you to answer in the blog that you're going to post, where you'll list some references for the folks that are interested in looking. So bringing us to the end of today's web forum, I really want to thank you. You did a terrific job. This was such a deep topic. I know we could go on and on and on and still have more questions, and probably all of our brains would explode simultaneously. But with that being said, just for everybody's future reference, the recording and the slides will be available in about a week on dialogueforhealth.org. You'll find the recording, you'll find the slides, a link to the slides and all the references today. If you're interested in reaching over 25,000 public health professionals nationwide, consider hosting an event or becoming a sponsor with us. You can contact us at info@healthleadership.org to find out more. And thank you, everyone. Have a great rest of your day. Bye-bye.